A warm welcome to our speakers and, of course, to all of you who are participating in this breakout session from all over the world. I am Nandini, Oomman, a global health specialist and also the CEO of the Women's Storytelling Salon based in Washington, D.C. I'm also very fortunate this year to be a fellow in the inaugural US cohort of the Women Lift Health Initiative at Stanford, which is committed to expanding the voice and power of women leaders in global health. It is truly my great honor to moderate this session with two outstanding leaders from the health sector in India. Our session will be 55 minutes long, and we will leave some time at the end for questions. And we might have one of our guests leave slightly early, but we'll try and do her questions just before she has to leave, Dr. Swarup. As we all know, COVID-19 has and continues to strain public health systems and cause economic disruption across the world, including South Asia and, of course, in India. This, of course, poses unprecedented challenges to those in leadership positions. This session will highlight two of the most critical leaders in India's response to the pandemic from the public and private sectors, which is very special because we need to hear from both as they both play a vital part of a functioning health system. And this is important so that we understand the ways in which they are adapting their leadership to meet the country and people's needs during this crisis. So it is my absolute pleasure to introduce our speakers. Dr. Renu Swarup is the Secretary, Department of Biotechnology in the Ministry of Science and Technology of the Government of India. She has actively contributed in the formulation of India's biotechnology vision and strategy and is credited with the establishment of the NCMR, or the National Center for Microbial Resource in Pune, India. Just a small fun factoid that I read about Dr. Swarup is just this year, a newly found salt-loving microbe was named after her. I hope I say it correctly, Natrialba swarupe. I thought that was really interesting, and that is, I'm sure, a story in and of itself. Dr. Shobana Kamineni is the Executive Vice President, Apollo Hospitals Enterprise Limited, which is the pioneer of private healthcare in India and is Asia's foremost integrated healthcare conglomerate. And she is the first ever female president of the Confederation of Indian Industry, CII, elected for the year 2018. And a fun fact about Dr. Kamineni is she decided to learn how to play the drums at 50 and is a big sports fan because she loves adrenaline. So we've got two fantastic women ahead of us here. And a very warm welcome to both of you. And I just wanted to say that, you know, our speakers have accomplished so much, which you can read about in the linked bios on the conference website. If I were to sit and describe a summary even of all that they've done, we would be here all day, and we're crunched for time. So let's move straight to our conversation. Excuse me. Before we start, I wanted to share some special news about both our speakers that I learned from the conference organizers, that both Dr. Swarup and Dr. Kamineni have been major champions for this conference, working for almost 2 years with the team at Stanford to make the in-person conference that was supposed to happen in India a major success. And they continue to do the same even though the conference has gone virtual. And I want to make sure that we acknowledge your support from two very powerful leaders like yourselves who believe in women leaders in global health, the whole vision of it. So let's get right to it. Some questions will be for both of you. Others might be specifically addressed just to one person, and we'll move the conversation along in that way. So to start, I'm going to start first with Dr. Swarup. As you might have picked up in the introduction, I love to listen to stories, whether they're in global health or all kinds of other stories. So I'd like to begin by asking both of you to tell us a story of what the last 8 months have looked like for you in your leadership positions. This is no doubt probably one of the most challenging times of your career. And I think a short story just describing to us all the things you have to deal with as a leader to respond to COVID-19 would be very interesting to listen to. Dr. Swarup.
Thank you very much, Nandini, and good morning, good afternoon, good evening to all those who joined us. It's really a pleasure to be with you here And it's a pleasure to see that we are having this very, very important summit, something that we've been talking about, working with the team for, as you rightly said, over 2 years. And it's really a pleasure to be here. It's really wonderful to see that we have been able to get these women in global health together, and I have to thank the team. I have to thank Shobana for being such a wonderful champion with us to bring us to where we are today. So, if you would have in normal times asked me, Nandini, what really did the last 8 months look like? I would have said we've been so busy just for this Women Lift conference and working around it, which is true. We've really worked towards it. But I think, yes, I'm not wrong in saying that the major part of our agenda during these last 8 months has been how do you tackle this COVID crisis? Coming from the Ministry of Science and Technology in the government, the Department of Biotechnology is actually leading from the front and having this responsibility to see that we deliver scientific solutions to be able to tackle this pandemic, which came to us, totally an unprecedented time, has been a great challenge. And I think that really is what we have worked on in these last 8 months. India itself has provided great leadership in tackling the COVID 19, and the Science Ministry particularly has responded. Our scientists from the academia, from the startup community, from the industry. And I think the key challenge that we were faced with is how do you bring these groups together who are working in diverse areas, but they are areas which would very quickly come together to respond to the COVID challenge. And I think that was an immediate priority. Very pleased to say that we saw this happening very quickly. And what we have seen as a response to COVID has given us a level of confidence that now we would be able to move into the any sort of crisis that we move ahead, or even looking at normal collaborations as we move forward. I think the response that has come in from collaborations nationally, globally, and also more importantly, our own startups, researchers coming forward with what our Prime Minister put out as the clarion call of Atmanirbhar Bharat. I think that itself was important. So in these last 8 months, it's been a challenge to bring this together, but it's been a satisfying experience because we've been able to come to what we are now delivering, and we do see quickly the results. So that's really what these 6 to 8 months have gone into: connecting, but more important, strategizing, connecting, executing, and trying to see how we get it implemented.
Yes, that absolutely sounds like, I think, a formidable task, which I'm sure you have led with great leadership. And I'm just wondering if you might elaborate on perhaps how many different departments and partners you had to bring together, and who were these partners that were just in biotechnology or across the board to actually respond to the crisis at the time that it started.
So this is, as I said, Nandini, a unique opportunity where a challenge, but we also look at it as an opportunity where we could bring the global community to work with the national group. So that's one network that we had to connect. Within the government system, we had the entire Ministry of Science and Technology. We needed to work with the Health Ministry, with ICMR, the academic groups, the startups, the industry. But I think what was also important is working at the ground level, working with the health workers to see and understand what their requirements were, whether it was diagnostic kits, where we needed to bring up the diagnostic indigenously manufactured kits to see how we could get them implemented. How do we actually reach out to the remote areas where testing needs to be done? And for that, we quickly developed a mobile laboratory which we could respond to these. So it was really a two-way approach, getting the needs from the users and the scientific community then responding to that and seeing how we can put it together. So that really was the challenge. But within the implementing group, as it will be, we had over 100 startups who came together.
Mm-hmm.
We had nearly about 70 research institutes and groups who came together. And we had an equal number of large number of industries who've come together. So you actually have a very large group, about 300 to 400 scientists, researchers working collectively to be able to deliver solutions, whether it's vaccine, whether it's diagnostics, therapeutics, the phytopharma products, all of them, and seeing, understanding the virus, the genomics. We had 1,000 genomes across the country. So every state laboratory, state hospitals, so working with all the state governments. So it was it's a huge network which is still on the ground and still working very hard.
And we know that all good networks that perform well need good leaders, and so I'm sure that the network has been very successful in your hands. And I think absolutely that a challenge does really present also great opportunities, and a good leader sees those opportunities and seizes them to continue the work. So thank you for that. I'll turn to Dr. Kamineni to ask you the same question. If you could share, the story of your last 8 months, what has it been like, and how have you stepped up to the plate as a leader in global health?
So let me share a response first.
Okay.
Someone was asking, I was going around the room asking friends and family, what's your COVID talent? All this time during lockdown, what have you learned? And my husband turned around and said, I've learned that we might live in the same four walls, but I've seen her less in the last 35 years in these last 6 months than ever. And I think this just goes to show that this is the amount of work and pressure that has been put on us. It's unprecedented. And my dad is 87. He founded the group. And he says that never in his life has he encountered this amount of, the threat to life and the threat to existence and what will happen later in terms of the economic, in terms of the health, in terms of the sociological crisis. Is actually a trifecta that we have to look at and understand how the impact. One thing is, at least I had a job. And when I would turn around and people asked me, they said, at least you have a job. Well, they didn't realize that, the job would take so much out of you. Because at the same time, we launched our digital portal of health. And people asked me, they said, how did you get this timing? And I said, well, luckily we were in it for the last 6-8 months. I had sold a previous company of mine, so I had time to pull all of Apollo together in our data. And all of a sudden, when doctors are sitting at home, unable to practice, when the hospitals are empty, that's the situation that they come back. They came back to us. In 45 days, we onboarded 3,000 doctors in our hospital system and started telemedicine. We turned all our physical, of course, the 4,000 pharmacies we have around India, they were still open because they're a critical service, but there were a lot of people. I think one of my favorite incidents was I got a phone call from a shareholder and said, my parents are in their late 80s, stuck in Bhopal, it's raining, and they can't get to a pharmacy. They need medicine. Can you help them? And we just, checked. We had the network, and within an hour, they had medicine. So I think this kind of connecting. So it sounds like a great human story, but it takes a whole amount of technology. It takes a whole amount of expertise. And I think that this is something that during these unprecedented times, when you go out, the new normal will be highly digital and innovative. It'll be meshed into our lives. We will not forget about some of those comfort, whether it was a hotel, whether it was a restaurant, or whether it was any of these services, have really become way more legitimized during this lockdown. The second insight that I want to give you is something that Dr. Swarup spoke about and said how she, the entire engine to keep COVID, what we had to deliver, whether it was ventilators, whether it was PPEs. And this was a massive effort that, if hospitals like hospital systems, private and public, if they were left wanting, it would have been a disaster. And this is where the government really stepped in. I can't tell you that the collaborative efforts that before it could have, that whatever people said about talking, this was the time that the government and the private really swung into such fantastic action. And I think this kind of innovation, and I really hope that beyond COVID, this is a skill that we've learned, that we need each other, we need to partner, we will work together. And the last one I want to tell you about this entire COVID is how much we've learned of how frail and how little we know about about our health conditions, and actually about COVID also. Every day we're learning new things, and we think that this is not a struggle that is going to get over. Everyone, our doctors, our nurses were exhausted 3 months ago, but now they went beyond exhaustion, and you get into that phase, that circle of never ending. We don't think that is going to end, at least in the next couple of years, till A, we find a cure, and B, we're able to gear up our understanding and our protocols. Today, we're on the 23rd protocol of how to treat COVID, because new medicines, we're learning new things, how to do it. And I think that I would want to leave you with was one of the benefits that India locked down early. We learned from some of the protocols of the world. But what happened is that in India, medicine is available much cheaper, much faster. And fortunately, we will be the world supplier of that vaccine when it comes. So I think that in this space, truly, that this that whatever that people look at in terms of this crisis, they say that today's scars are tomorrow's stripes, and this is the time of leadership. I would think that it's not about Dr. Swarup and me personally about leadership, but I think I'm actually very proud of what our country has done in terms of a leadership position.
Absolutely. There's no doubt about that, and I think people are excited about India's role in the production of the vaccine, and really continuing to be sort of the pharmacy for the rest of the world, as they have done with other drugs. I wanted to stick with you, Dr. Kamineni, and actually extend that a little bit to the question of how a hospital system like Apollo is actually approaching this moment, particularly around gender inclusion. So perhaps you could give us a sense of what steps as a leader you have taken to ensure that those around the table that are making these tough decisions and choices are actually thinking about the predominantly female workforce that's been on the front lines. And I think we would really benefit to understand some of those insights.
Anyone in India will tell you that's a wrong question to ask anyone from the Apollo family. It was the luck of it was the luck of birth that my dad had four girls, and all four of us. So the entire leadership, the senior leadership, is all women. But jokes aside, I think that the seriousness of this is that while gender is very important, we've always been healthcare is something which is more than equal opportunity for women, because you will find huge amount of women doctors enrollment in educational institutions. So we're getting actually not just 50%, but slightly over that in terms of enrollment. We have 2 medical colleges, huge amount in terms of nursing, technicians. So I think that in terms of gender parity, healthcare is a really nice example of what women can do, of pay parity and how they can rise and creating sustainable jobs. But one thing I would like to say in this COVID time is that we've been out of our 70,000 workforce, about 2,500 people have contracted COVID. We've had 2 mortalities, so I think that we've had a pretty good track record. but no one who's working in our 3,000 COVID beds have actually contracted it from that site. It's usually from the community. So I think that hospitals have been very careful in its protocols in making sure that we're creating safe environments, not just for the people working here, but also for the non-COVID patients that we're now starting. The electives and the really sick have have had to come back. And I think that's what we're seeing now, that this is a time which is actually more critical, because we have 3,000 COVID beds, but we have 60% in others also.
Correct. That's very useful to learn about. So maybe I'll turn to Dr. Swarup to ask you, Dr. Swarup, how this pandemic has really forced you to adapt your approach to leadership to navigate this very important moment and meet both the country's and her people's needs. And how has gender played a role in your leadership approach?
So Nandini, this COVID situation has actually given us, as we all say, a very unprecedented situation, not just in terms of what our response is, but also the time to the response, because that's more important. And I think there it is key that when you have these sort of time bound missions, and this is not a mission which we are taking that, okay, if it gets delayed, it's fine, we do have time with us. It's a health crisis. Humanity is dependent on what really the solutions are going to be there for. So I think at that point of time, it's very important then to see that you identify the right people,
Mm-hmm.
and then you empower them. It's not the time to go through those traditional hierarchies and then, so you really need to empower the young leaders with that take on this responsibility. And that's really how teams work. So this really is one opportunity that we had to identify the right teams, empower the young team leaders, give them the responsibility, make them accountable for what their deliveries are. And I think that is a truly one, if a good leader has to perform well, you need to have your teams performing. And this is an opportunity where COVID gave us an opportunity to see that we have these excellent teams who then take on the responsibility and deliver. And I was very, very fortunate that in this working that I've done, I've had these wonderful teams which got built up, teams within my own department, within my organization. But as I said today, when I look at it, it's actually from the entire country we've built up teams. People who've come in from other organizations, people who've come in from the industry, and very rightly said by Shobana, this has been one occasion where we've seen all these different boundaries being blurred. You really do not see whether it's a private sector or a public sector. We need a diagnostic kit. We need the kit to be delivered. And you find all ways of getting it together to be delivered. We've had such innovative models of implementation, which we would have never thought of in our routine manners in which we work. And to just give you a very, very small example, when we started our indigenous kit development in March, we realized that we had to be 100% self-reliant because the country needed that volume of kits for our testing. We got our startups to develop kits, and we then realized that there was going to be a roadblock, and that was the components, because there were supply chain disruptions, there was a global demand for those same components which were imported. We quickly put together a consortium, and that consortium brought in about 30 industries and startups who were developing similar components but for other products. And we said, your demand aggregation is diagnostic kits. And within 30 days, we had 40 startups and companies coming together. And today, they're all collectively providing 100% of the components for these diagnostic kits. So that really was the innovation that we brought in terms of our implementation. And coming to the gender, I think what Shobana said about the Apollo, I can easily say about the Department of Biotechnology and BIRAC, because we are I think if you look at the numbers, we actually have more women within the Department of Biotechnology and BIRAC. And I think that's also because biological sciences actually attracts a lot of women. And so if you have to say that good leadership delivered, good teams delivered, a lot of credit goes to these women. But I always say it's a gender diversity which is important. It's not just bringing in one single gender. So we do have this gender diversity. And I think that's what we focus on. We focus on this to try and see how we give equal opportunities. And it was also important for us to see how we address the maternal and child health and other women health related issues, which we've done through many of our programs. We have today the largest cohort of preterm birth, which has been driven by one of our major institutes and working with other groups internationally. And they have now taken on the responsibility of a COVID and a post-COVID response. So maternal child health, all these are key issues which we have taken into our program.
Excellent. So let me then pivot to the question that I would love to know about. So I recall that when I was in high school in India, I was one of two girls in my math and science section. As you know, in 11 and 12, we have to choose our focus. And I remember thinking at the time that it was strange that there weren't more girls doing science. I mean, there were, I think, some in biology, but not in the full spectrum of math, physics, chemistry, and biology. And I'm sure that has changed now. But taking a step back, I'm wondering if you could share some of the, common roadblocks that prevent women from advancing their careers in STEM in India and South Asia more broadly. And I think you've already touched on the point that there are many women coming into science. So there are many women now who are studying it, and at the entry level and certainly at the mid-career level are populating both the public and private sector. But if we're talking about women leaders, what are some of the roadblocks that prevent that ascent to higher leadership positions? Because as we learned, 25% in global health are women leaders. The rest are all male. So I think it would be very insightful to learn from your eyes how that's taking place in India.
Nandini, we have from the government of India also now taken a lot of initiatives to try and see how we bring in more girls into the science field, how we encourage them, how we encourage the women researchers to get into the mainstream of research. And between the Department of Biotechnology, Department of Science and Technology, a whole array of schemes which actually helps them to move ahead. But I think the point that you're saying, what really is the roadblock? We do keep talking about numbers being very low at the top. But I think it's important for us to understand that if you need larger numbers at the top, you need to have a very strong base or a very strong foundation. And I think that really is currently a big challenge for us. And that's why we are looking at expanding the base. Because if you have a large base, because it's when you look at any women leadership, I think whenever you would like to bring in senior women leaders, you're not going to compromise in the quality. You do need to bring in the merit, and no woman who's wanting to reach there would want the quality to be compromised. So you have to build leadership qualities. And I think this leadership development should not come in very late in the career. We need to look at leadership development right from the beginning, and that's what we're focusing on. Trying to see how we bring in that pyramidal effect so we have a very, very strong foundation and bring in leadership development, growth opportunities for them at that, and then allow them to naturally move along with their other contemporaries. And if they do well with the leadership qualities in them, there's no way they'll be left behind, because they do have a lot of inherent strengths and a lot of inherent skills, which anyway gets them forward. But I think it's making them recognize what that inherent skill and whatever that inherent strength is. And from the government, we're doing a lot to try and see how we can do that. And I think that is currently one major initiative and one attitude that we should really address greatly as we move forward.
Thank you. I think that's very encouraging to hear, and I'm excited that there will be efforts to bring in more women into the sector and follow them from the early part of their career, sort of up the ladder, as it were. So turning to you, Shobana Kamineni, let me ask you, similarly in the private sector, and you did actually allude to this earlier, is that the pandemic will actually act as a catalyst for changes many different kinds of changes in the future. So I was wondering whether you would apply that to also seeing more women, not only in the field of medicine, but also rising to leadership positions in biotech and medicine across the board, even in the private sector. So really the growth of women entrepreneurs, as well as in the private healthcare delivery sector.
Nandini, in a perfect world, I would completely say that this is this would have been the perfect storm that women could shine, because when you remove, when you have work from home and you don't have this travel and things like that, it's actually a perfect environment for women to contribute, because they don't have the challenges of commuting, or they can work from multi geography and so things like that. And earlier on, I was a little optimistic and I said, here's a great time for women to shine. But the reality of it is that this has been a very challenging time for women. If you see that, if you look at the statistics closely during the pandemic, there have been more women who have lost jobs than men. Right. There have been challenges for women to actually step up to study, because when they say that there's a sketchy internet connection, or you only have this much at home, and hard choices are made, usually it's the women that miss out. So when you get down to the lowest economic strata, you're going to actually find that even in basic education, they'll move out. So I think it's super important for us in this women leadership positions that all of us hold, that we have to push this needle all the time, because it's not going to happen because of the pandemic. That it should have been, but when you actually look at reality, these are very hard times for women.
Absolutely. Yes, I think that is something that I think we have to be mindful of. I think a crisis can serve as a catalyst, but we certainly have to keep at it even after. So I appreciate those comments. I think I want to just ask one last question of Dr. Swarup before we turn to some questions from the audience, because they are coming in. Dr. Swarup, there's a lot of excitement about India's role in the manufacturing of the vaccine moving forward. And I think that people are looking all over the world to India's capacity to produce large volumes of the vaccine when they have passed the phase 3 of the clinical trials. So I'm just wondering whether you could give us a sense of whether women have been part of this huge vaccine movement in India, and if they have, it would be wonderful to learn about that. But if they haven't, what might be the cost of not having women part of this, both in terms of the actual development of the vaccine, but also then in the sort of distribution of the vaccine when it is available?
So Nandini, as I said, in India, biological sciences does attract women. So I think if you look at the vaccine development story, we do have women who are at the industry level. We have women who've been contributing, whether it's biologically or whether it's Bharat Biotech. We do have women who are keenly engaged in it. And then you have people like Kiran Majumdar-Shaw and many others who are leading this whole vaccine development. But you're going to, and then of course within the own government system, if you see, as I said, my own department, we have women. Are the main advisor from my own department who leads the vaccine program is a woman. Our mission director who's leading it for the biopharma mission is a woman. So there you are. We have all these women who are leading all over. But yes, when you talk about the vaccine delivery, I think there you need to have two aspects of it. One is, of course, the actual vaccine immunization program. And I think there, the women at the grassroots, the ASHA workers, they're really going to play a very important role. And as they've always done in all our child immunization programs. And we do see them playing a very, very important role as we move into our rollout of vaccines. And of course, the hospitals, and you have networks which, like Shobana has been talking about. So if you have women leaders like this, who are now going to take it ahead. So India has that leadership already there, which is once we have the vaccine developed, we will definitely get the rollout and the delivery, and women will be, they will be, and they'll continue to be an integral part of this whole ecosystem.
Well, that's really exciting, and I'm looking forward to watching that and seeing that roll out. So one last actually, I'll maybe save that to the before. I think I'm going to go with an audience question, given that Dr. Swarup has to leave, I think, in about 8 minutes. So Dr. Swarup, I'll start with you. A question from the audience has come in, and the question says, how can we harness the collective power of such great women leaders in the system to focus and advocate for better working conditions for women who are working at the front lines without much access to appropriate PPE and who are low-paid workers?
So I think that's a question which Shobana has anyway responded to in her conversation. You see, as a woman leader who has been leading in the hospitals, in the medical infrastructure, health delivery ecosystem, she's already given to you what the Apollo system has done, and that really brings in the moment you have women leaders there, and that's really how you harness the potential. They bring in the diversity, they bring in a much because there are inherent qualities. It's not, and here I now speak as a genetist, because women have genetically a different makeup. So they have passion in them, they have empathy in them. And I think that comes out when you talk about health infrastructure and health delivery systems. So I think it's important. And as I said, in India, we are fortunate that we do have this ecosystem that exists. And women do occupy very important positions in decision making, not just within the government system or leadership positions in the private sector, but to a great extent, even as we go down to the district levels, we have women panchayat leaders. So India has that, we have developed that ecosystem. And now with the government's focus on the women and child development, the government's focus on looking at our nutrition, Poshan Abhiyan activities, we are finding more and more ways of empowering the women there. So you don't just have women leaders in the traditionally leadership position that you see, but it's also empowering the young leaders. So it's all about empowerment. Once you give them that empowerment, you can actually have leaders at different levels. And that's really how we would like to see this being harnessed and then taken across the country.
Dr. Kamineni, would you like to add something to that question or to that answer in terms of the provision of PPE and other safety for workers who are low-paid workers who are at the front lines of this response?
So one is that I think that the way that this response was done is that once people started understanding it more and how this would spread and the way that it moves, that India was very early when it's, in talking about lockdowns, in talking about social distancing, in making masks compulsory among the public. And I was just reading an article of how, these are the things that, create a positive R0 factor and really limit the super spreaders. So we understand that, but you just have to understand that we have a 1.3 billion population, so many of them in the districts and, so spread out geographically. So you can't be as disciplined as we should be. But I think that the government and the private sector, everybody has pitched in to make sure that the message went out far and wide. Now, making sure that it stays, so we have enough PPE, we probably have the cheapest PPE, we've said, so there's access, there's no shortage in India. That's one thing I clearly want to tell you, that we don't have a shortage of beds, we don't have a shortage of ventilators, we don't have a shortage of medicines. It might be that we have geographic access is difficult, but thankfully technology, we're trying to overcome some of that. But what we have is that it's very difficult for a 1.3 billion population at all economic strata to really understand, because at the end of the day, this pandemic has pushed 60 million people into below the line poverty. So I think the economic the economic choices are far greater at this point. So I think that has to be looked at.
Absolutely. So I'm mindful that Dr. Swarup has to rush to a ministry meeting, which is what leaders have to do. So I want to just ask her to give us some closing remarks. And in that, I would really like to know, given all of the challenges and how overwhelming it has been in the last 8 months, Dr. Swarup, how does a leader like you actually look to hope in the future to continue the great work that you're doing?
Thank you very much, Nandini. It's been an excellent conversation, and thank you for bringing out such wonderful issues through these questions. I hope the viewers have enjoyed it as well. I just wanted to say that in these last 2 years, engaging with the Women Lift Health group, with Shobana, all the steering committee members, the team at Stanford, it's been such a wonderful experience to see that across the globe, we have similar challenges that we're all trying to address. And I think that really is important for us to see that how do we, these are summits which give us an opportunity to come together, to bring our collective ideas. We pick up best practices from each other and then collectively find solutions which suit our ecosystem. We would have actually loved to have this as a physical meeting where we would have had more interaction opportunities. Mm-hmm. The pandemic obviously stole all that away. We hope next year in October, we will be able to do a physical meeting. We hope the pandemic is going to go by then. We hope we could have everyone travel into India and we have the opportunity to be able to host you all. But I think what we would like to do is, in the run up to that, I think it's important for us to institutionalize this sort of a platform that we have been able to create. We've been able to engage with a lot of young leaders, young women leaders, and they need to get these opportunity to see their role models, to find the mentors, which obviously cannot just be restricted to India. Their mentors have to be globally accessible to them. And these platforms give them that opportunity. So we're really going to work along with all the partners that DBT, BIRAC, Apollo, many other such groups, ICMR, all our ministries to see, and of course the Stanford group, to see how we could bring in a platform within the country, to have this as an institutionalized platform, which is not just limited to conferences and summits, but gives much more mentoring opportunities. And in this run-up, I think what we are planning is maybe around March, we would do one national meet where would we bring all our young leaders at different levels, those who've responded to COVID, those who have responded to other than COVID health emergencies. Let's not forget those. Correct. They're so important. We should, because of COVID, we should not neglect all those. And we have many women who have become leaders and responded to that. So we look forward to that opportunity. And a lot of learnings from COVID that we'll take ahead. More important is that we can deliver, we can come together as a team, and collaborations give us a much better added advantage. So thank you so much for this opportunity. Nice. We'd love to stay connected beyond this meeting as well. Thank you very much.
Thank you very much, Dr. Swarup. I think that we're very encouraged by your words. And as they say, we're on to a good thing. So I think that, even beyond these summits and conferences, I think there's a lot of momentum to have women leaders really realize their potential. So as I would do in India, thank you very much. And we really value your time and participation. Thank you. So
thank you, Renu. Thank you.
So we're going to...
I know you have to rush.
Yeah, right. We're going to say goodbye to Dr. Swarup, but continue our conversation with Dr. Kamineni, who's really kindly agreed to stay on and have the entire focus on her. So I'm going to, just ask you some of the questions. A lot of them have been coming in from the audience. And so let me pick something that I think we haven't heard about already. Yeah, so I think this is something that, we talk a lot about in the whole circles of women's leadership is what more can we do as institutional leaders to improve work-life balance for women? The pandemic has put so much added stress to women's burdens at home. How do we create better organizational environments for women to flourish and rise?
There's no single answer to that. I think that what's important is that we have to say that technology is now a tool. Work from home is now a reality. So all women should be given an opportunity to be able to exercise that. And I do think that, especially the young women that have babies and they have the challenges, the ability to work from home is actually not a burden, but it's a benefit that they don't have to opt out of the workforce, continue to work from home just like their colleagues. So I would think we need to double down on this capability, but ensure that in an overall economic sense, that we continue to push the bar, saying that there should be diversity in a workplace, that whether it's a Zoom room or it's an actual physical space, having women really makes an organization stronger, and it makes their ability to be future proof much better. So I think we should look at whatever we were doing earlier, but add what we've learned in the pandemic of how to work efficiently from home as a benefit.
So that's really interesting because I know that in the US, the statistic that I read the other day, which was quite alarming, was that in this setting, I think the rate of job loss or the ratio of job loss is 8 women to 1 man during the pandemic because of course, changing situations. So certainly over here, the narrative for women who are mothers at home and working a job full time, it's been really challenging. So are you suggesting that in India, actually, that is not the case because of perhaps a larger community and family setting that helps women while they are on the job, even from the house? Or how is that playing out?
No, Nandini. Nai, I'm glad you asked me this because I think that we have to understand the context.
Mm-hmm.
The context is really the organized jobs. The organized jobs that really are not manufacturing because you still have to be physical in a manufacturing facility. Mm-hmm. And a lot of those jobs went away. They weren't, a lot of them that were, that they laid off the women first. And if you see the textile workers, mostly women. So those manufacturing jobs, you obviously can't do it from home.
Right.
We have to get that back into play. So that's super important. The next lot of jobs are the ones that are, the service jobs. So the service jobs, the hotel industry decimated. There were a lot of women doing work in that. I think that's going to be a tough one.
Mm-hmm.
So which are the ones, like if you look at the IT jobs and places where, that require, that give them the luxury from being able to work from home and deliver a service. So even if you're looking at a small businesses that you can do and you can sell online, the e-commerce platforms and all this that has opened out, I think that there are opportunities for women to actually move into such areas which are fairly exciting and allow them to work at their own pace. So there's going to be many different types. Agriculture, for instance, you still have to go into the fields. But how you sell the products is a very different thing that you can actually use online platforms, and women have an ability to be as, they don't have to drive this to the station and dump it. You can actually put it on an online platform and say, I have this to sell. So I think that there are opportunities coming up, and it is up to us. It is up to the large platforms that we have to recognize this. So I think that a big takeaway would be that we have to be mindful, mm-hmm. that we have to continue to push the envelope, that women have suffered even before the pandemic.
Right.
In India, the women in the workforce declined by almost 5 to 6%. We were the lowest in the world, and now we're even lower. So it was always a bad statistic. Correct. And now there's even more pressure. So I do think that this is a time, and if the one thing that this conference can come out to say, that we have to make sure that we're provisioning for more women to find jobs.
Absolutely. Yes, I was struck actually by a conversation that I had with a friend who's in the pharma industry, and out of the 5 women in her network, 4 women in the US in the pharma industry have lost their leadership jobs. So yes, it's really, really difficult to hear that kind of news. I think this is what we really have to be careful about moving forward. So I think that we are, I think I'm going to turn to my question to you before I close out the session. We have about 3 more minutes. Just like I asked Dr. Swarup, this is a time of both, I think, great challenges, but also opportunities. But because it's been such an overwhelming, 8 or 9 months, like you said, your father, who's the founder of Apollo, said he has never seen anything like this in his lifetime. So with that daunting feeling of, oh my goodness, there is just so much that we have to do. What is the hope that you see moving forward that's going to carry us through a pandemic like this and a crisis like this?
That human beings are smart enough to learn this time. I think that we've seen that in certain cases, they've just, there's been, while we've had great environment challenges, in other places, we've actually seen the environment blossom, the quality of air in the big cities in India, some of the jungles in India that have a higher population. So I think that I would always come back to that one thing of saying that human beings have to understand how we need to live in a world to be able to create sustainability. And now we have to add this extra element of danger of extinction. Mm-hmm. So we have to prevent it by finding better ways to understand and to live, and how to handle such a crisis. This is not going to be the last pandemic. And the third one I would tell you is that whenever I look at economic losses, and the first time in the figure was that the world was going to lose 20 trillion. And I gasped. Today, they estimate that the world will lose $80 trillion from this pandemic. Right. And it's actually only 20 billion to contribute to find a vaccine and to give it to everybody. But the economic losses today have mounted to 80 billion. And the worst part of this is we're going to be paying for this, not just for 2 years for what they talk about recovery, but our kids will have to pay for this, the economic spillover. So I do hope that we can understand this and actually move forward. Let's keep this world not just environmentally, but socially and economically vibrant for generations that will come after us.
Thank you. I think that's absolutely right. The sort of power of human potential is great. And I think that is something that is going to carry us through this. So I will just end by saying that there's just so much that you and Dr. Swarup covered in this, from challenges and opportunities to identifying and encouraging young leaders, and just how in so many different ways women have participated, as well as have borne the brunt of the challenge of the crisis. In terms of both losing jobs, but also being at the sort of front lines of the pandemic. So I think that with that, I will say thank you to our viewers as well who participated in this session. And we really hope that we can have continuing conversations. And as Dr. Swarup and you have both said, continue this work, even outside of summits and conferences. In our daily lives, it'll be important to harness that human potential, all human potential, male and female, to carry us through. So thank you, Dr. Kamineni, and thank you to our guests.
Thank you,
really a wonderful session. Thank you so much.
Super. Thank you so much. And thank you to everyone for listening and spending this hour with us.